Today we will be teaching you the proper technique in performing insulin administration. For this procedure, you will need 1 injection tray, 1 sterile insulin syringe, 1 sterile Kelly curve forceps, sterile wet and dry cotton balls, the insulin vial, 1 sterile injection towel, 1 denatured alcohol, 1 match box with match, 1 medicine ticket, and a waste receptacle. Check the patient's chart for the doctor's order for insulin administration. To ensure that the procedure is done to the right patient at the right time, with the right dose, right drug, at the right route and site. Transcribe the doctor's order into the medicine ticket. To eliminate the need to carry the patient's chart when rechecking the drug, dose, and patient's identity. Explain the procedure to the patient. To comply with the patient's right to be informed of any procedure done to him or her. Gather the necessary materials, then perform medical hand washing. To save time and energy and to avoid cross-contamination. Get 1 dry cotton ball using the sterile forceps and place it on the hypo tray. This will serve as your instrument for flaming. Pour denatured alcohol on the cotton ball and ignite. This is to start flaming. Pass flaming cotton ball over the hypo tray in one direction from top to bottom. This is to sterilize the hypo tray. Open sterile injection towel on the hypo tray. Fan-fold injection towel on one side. This will serve as a covering for your syringe to avoid contamination by air. Using the sterile forceps, place the following items on the injection towel. 1 sterile dry cotton ball, 1 insulin syringe, and 4 sterile wet cotton balls. To save time and energy.
Away.
Place one wet cotton ball on the top of the insulin vial. Then disinfect the rubber cap of the vial with the cotton ball, then your hands using the same. To disinfect the vial and hand to avoid contamination. Get the insulin syringe and withdraw exact amount of prescribed insulin from the vial to administer the right dosage. Place the insulin syringe back on the injection towel. Close the towel covering the syringe to prevent contamination. Insert the medicine ticket under the injection towel in line with the syringe to serve as reference when confirming the patient's identity. Bring the hypo tray with materials to the patient's room. Ask the patient to state his or her full name. Compare it to the medicine ticket to confirm the patient's identity. Select and expose appropriate injection site to provide easy access. Get a wet cotton ball and disinfect the site for the injection, then discard. To get rid of microorganisms on the site and avoid causing infection. With another cotton ball, disinfect hands and wet cotton ball, then discard to avoid contamination. Get another wet cotton ball and place it between your small finger and ring finger of the non-dominant hand. This will be used to apply pressure on the site after administration. Grab a substantial portion of the skin and subcutaneous tissue between the thumb and the other fingers of the non-dominant hand to ensure that the insulin is administered properly. With dominant hand, inject the needle into the site using a 90-degree angle since the needle of the insulin syringe is very short to ensure that the insulin is administered subcutaneously. Then, support the hub with the thumb and index finger of the non-dominant hand to maintain stability of the syringe. With your dominant hand, slowly push the plunger down to deliver the medication using a cigarette position to administer the insulin. Place wet cotton ball over the injection site, apply very little pressure, then withdraw the needle quickly to avoid bleeding. Leave the wet cotton ball on the site. Do not apply pressure anymore to avoid insulin from escaping from the site. Check for bleeding and for possible reactions or complications. To implement interventions when complications occur. Then, do aftercare to fulfill nursing responsibilities. Document the following on the insulin injection log. Type and amount of insulin used, site used, time of administration, route of administration, reactions of the patient. To provide a legal document for future reference and to communicate with the other members of the healthcare team.